Makoplasty is a computer-assisted technique that helps a surgeon perform knee or hip replacements.
It involves a custom 3D plan of the patient's joint, which we then bring to the OR and combine it with computer navigation. And then finally, a robot-assisted surgical arm, which is surgeon-controlled, that brings together these three tools to provide the most accurate joint replacement possible.
The way it differs is for many years now we've been doing hip and knee replacements. With knees, we've had mechanical guides in the operating room. When we do a hip replacement, it's pretty much looking at the bony landmarks to decide how to put the components in.
With Makoplasty, we have a preoperative CAT scan performed on the patient. That information is used in computer modeling the patient's limb to produce a virtual model in space of the hip or knee replacement that the surgeon can then manipulate preoperatively to get the ideal position for the components.
The benefits are we get better position of the components. That leads to a better range of motion, hopefully a quicker rehabilitation, and longer lasting components.
Using a device like Makoplasty, where we can see in 3 dimensions and have information before the surgery and during surgery beyond what we can just see, allows us to be more precise, even with a small incision.
We believe that one of the keys to the implants, a hip or a knee replacement, lasting a long time for the patient is that the pieces have to be put in extremely accurately. And by increasing that accuracy, we think that hips and knees are going to perform better and last longer for the patients.
So it gives you a more accurate placement of the components so you get a better range of motion, less pain, quicker rehabilitation. The best candidates for the Mako are patients who are having a first-time hip or knee replacement. If they have to be redone, then there are other things that complicate that, but the first-time hip or knee replacement is probably the best candidate.
I think LRGH has really hit a sweet spot with our joint replacement care. We've been doing these surgeries for a long time. We've done over 500 Makoplasty procedures. We do enough cases per year that we can be very good at what we do, and we've had good results, but we're also not so big that patients become a number.
LRG has an extremely well-trained and very professional joint replacement team. We have one of the lowest infection rates in the state. We have superbly trained nurses and surgical staff, and this is a great place where people get not only state-of-the-art surgery, but excellent care after surgery.